Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our biweekly update on the pandemic in the state of Maryland and also at GBMC. So the story today is fairly positive. The number of people in Maryland hospitals who have been sick enough with COVID-19 to be admitted has continued to drop. We are at the lowest number we've been at since the turn of the new year. And the percentage of patients sick enough to make it to the intensive care unit continues to drop as well. Today, GBMC has 27 patients who are COVID-19 positive in the hospital and 0 on ventilators. This is excellent news. And I want to thank our staff, especially our hospitalists and inpatient med-surg nurses, for their great work in treating patients who are sick enough to make it into the hospital and keeping them from requiring the intensive care unit. Let's talk a bit about vaccines. We are following the governor's rules, and we are now in 1C, and we have begun immunizing people 65 years of age and older, and we have now begun immunizing inpatients who have significant chronic disease. We know that there is frustration within the community because the rate-limiting factor is now the number of doses available within the state of Maryland. You see on the national news, this is not a Maryland problem, it's a national problem, but it clearly exists in Maryland as well. There are now many new sites that people can go to get the vaccine, but the total number of doses arriving in the state of Maryland has not changed significantly, so each site is actually getting fewer doses. We will continue at GBMC to follow the governor's rules, and as of today, we are focused on people 65 years of age and older and critical workers in the community. You've heard a lot in the news about mutations to the virus and new variants. Dr. Fauci has reminded all of us that viruses mutate all the time. And the best way to reduce the number of variants to a virus is to stop the transmission of the virus from person to person. And we know that there are now 4 ways that we can do that, 4 important steps. The first one, again, please wash your hands. The second one, please stay socially distant. Keep 6 feet away from people. And because we cannot assure ourselves that we will always be 6 feet away from others, please wear your mask. Those are the 3 big ones that we've been discussing now for over a year. The fourth is, please, when it is your turn, get vaccinated. We must get the percentage of people in the population who are immune to the virus up to a certain level before we can start removing restrictions and get back to normal. And the fastest way is for members of the population to get vaccinated. So again, let me thank all the healthcare workers, not just at GBMC, but throughout the state and the country for standing up to the pandemic. And let me thank all of you in the community for your great work in doing what we're now calling the Big 4. We hope that you don't need medical care, but please rest assured that if you do, we at GBMC are here to help you. Thank you very much. Stay safe and stay healthy.